Hi, I'm really excited to be here today with Dr. Janet Schloss, and Janet wonderfully contribute a chapter on cancer, chapter 21, and she also updated the HIV chapter. How are you, Janet?
I'm good, Leah. How are you?
Really good. I'm so excited to be able to speak to you and talk to you about all your expertise and wisdom. Your cancer chapter is just absolutely outstanding, and it's so easy for the reader to really grow in that sort of specialty. How did you work out that you wanted to sort of specialize in that area?
Cancer in particular has always been my area of interest. I actually really love it. I've had, obviously, as with most people, I've had a huge family history of people with cancer, and so it's been something that we have lived with a lot. And when I went back and studied naturopathy, it was still my main area. And while I was actually studying, my auntie ended up getting bowel cancer and was seeing this, I'll say, false practitioner up somewhere who didn't actually have any qualifications. So encouraged her not to take medical treatment, was giving her all these potions. And she ended up having a really horrible death. And it had progressed quite badly. And it was one of the main reasons when I was studying, like I said, I had other family history as well, that, well, I think that we need people who are educated in this space to look after people who actually have cancer and be treating properly and not allow these, I don't want to say nasty things about them, but people who don't have proper qualifications or education, telling people what to do and what to take. So that's where my main interest in cancer came from.
Yeah. Look, I mean, you touch on a really valid point. You know, I ummed and ahed for so long about how do we tackle the discussion around cancer in this textbook, because it's such a unique area and you can really do so much harm if you don't know what you're doing. And I think, more than in any of the other specialties, you have to be so well versed and so integrative. And you really pulled that one off so beautifully. So thank you. And I think readers will get so much out of it. And I do think as well, though, that, and this is coming up every time we're having the interviews, that probably the gift of the textbook is that it really helps students and clinicians understand that to be a specialist in an area, you really have to be a specialist. Like, you can't just call yourself, that you've got an interest in something and, there you go, you'll start treating, because certainly something like cancer, you can really do a lot of harm, and it's a delicate balance. Yeah.
I totally agree.
Yeah. Yeah. And, I think that by having all of your content there, I think it really encourages people to do further training and encourages them to do further research. And I think it will help people take a step and actually really look at it and go, actually, I don't think I'm the right person for you. I'm going to refer you to someone that is more expert in this area. So thank you again.
Oh, no worries. I actually do things. I think that people are very scared about treating cancer in a lot of ways. Yeah. And as long as they have a good understanding and base, but if you're going to specialize in it, you need to know absolutely everything. And things are rapidly changing. Like every day now, we're coming out with so many different treatments and so many different immunotherapies. And if you don't know the medical system as well as what's actually happening in the body, you're never going to be able to keep up and be able to look and assist people.
And I think that's also one of those things, people often ask me, what area, you focus in and whatever. We've only got so much time. And I think it's better to be really well versed and well researched in a particular area and do it really well than think that you can basically be the equivalent of a GP and touch on all sorts of areas, because then ultimately you're going to be referring someone else out. So yeah, and I think that's really, really useful. But
I totally agree.
How did you find naturopathy, or did it find you?
It's quite interesting. I've always had an interest, particularly in nutrition, and in my, I'll say, previous life, I was actually a professional athlete, and I'd just come back from overseas, and I was back working here, and I'm a volleyballer, and was a volleyballer, not now, and I started working back here, and I'm going, this is not what I want to do. And I started looking around, and realized, I talked to quite a number of people and came to the things that, you know what, I want to go and study nutrition and naturopathy, because it's an area that I can see that, because I want to help people. I want to help and grow and do those type of things. And started studying and just loved it and knew that it was in the right area. And I mean, that's so many years ago now. but feeling old. That was like when I was 27 or whatever when I went back and studied. But I can't say it was definitely the best decision ever. And I think it's one of the best areas that most people can actually be. And, to have a book like this come out and to give people that information on all the different areas. And one of the best things I think that you've done is you've found specialists in each of the different areas to actually write the chapters. And like you said, we don't want to be a GP. We don't want to be the master at a superficial level across that. We do want to know one particular area really well. And then you've actually grouped that all together with all the specialists to actually give people the basis of it, which I think is fantastic. And it's a real tribute to you.
Thank you. But it's a testament to all of us working together. So I'm just really grateful for it. But I think it's, because so much of the gift of what we do as naturopaths is that we've got the time to be with people. We build the relationship and, to have that depth of connection with someone and then to be able to have that depth of understanding of a key area. I think that's where our magic happens. That's where we can really make the difference that we make, and certainly in your specialty.
I definitely think so. I think you made a real big key then to talking about building a relationship with the person. And I think that in itself is so healing, and we have the time and ability to do that.
Yeah. I think we're both pretty chuffed in our professions, which is good.
I know. That's so true.
But where are things sort of at for you professionally, and where are things heading, just so that we can get a sense and we can watch this space?
Absolutely. I'm just now making a big change from going from Endeavour, the Office of Research, which has been made dormant, to Southern Cross University, which I'm so excited about. So I've just joined and will be starting as of in 1 week's time, the National Centre for Naturopathic Medicine. Amazing. At Southern Cross University. Amazing. So in a university, in a naturopathic medicine research position.
Beautiful.
So it'll be part-time because I still want to see people as well. But it's a fantastic opportunity to work with some really good naturopaths with research skills and furthering both the research aspect of naturopathy within Australia and international.
Amazing.
So to me, that's really exciting.
Amazing. No, it is. And what a wonderful place to have a centre. So that's just
I know.
great. Yeah.
Lismore's beautiful.
No, I couldn't have picked a better area. And what about your own research projects? Obviously you're probably supervising some and you've got your own. Where are some of your key research areas?
Yeah, so at the moment I've just finished my major trial that I've been doing in research, which was for medicinal cannabis and brain tumours, glioblastomas. And we've just had a poster accepted for ASCO, which is the biggest American Society of Clinical Oncology. So it's the biggest medical oncology conference in the world, although it's virtual at the moment because of COVID.
That's all right.
I know. And we're waiting for it to be, it's been in review with the Journal of Clinical Oncology, which is also the highest journal for that. So we'll wait and see from there. So
well done.
Thank you.
Amazing.
So I'm now in discussion with different medical oncologists and doctors around Australia for the second stage of the cannabis and glioma trial. Also in discussion with some rheumatologists about looking at medicinal cannabis and fibromyalgia.
Amazing.
As well. And I have quite a number of other ones looking at herbs coming up, but I can't really say that yet because we're still under disclosure.
That's okay. Yeah, you can tell me then.
Okay. So I'm actually really excited because, as I said, starting at this new naturopathic centre allows me now to reopen all the trials that I was looking at and be able to work fulfilling those, which I love.
Amazing. Janet, you are such a phenomenal credit and asset to our profession. You're such a trailblazer with bridging all the research, and your passion and your care about patients with cancer is so evident. Not just in the chapter, but in the work that you're doing. Such a trailblazing effort to do the research that you're doing. It's beautiful. So beautiful to sit here and watch it all unravel. I'm really happy for you.
Oh, thank you. That means so much.
Yeah. Well, thank you for everything that you're doing and for participating in the textbook. And it's been a real honour to include you. So thank you.
Oh, thank you for having me and allowing me.
Thank you so much.
No worries.
We'll see you soon.
Bye.